Hello, and thanks for joining us for today's episode of CHS Presents Health Connect. I'm Dr. Patrick O'Shaughnessy, Catholic Health Services Senior Vice President of Medical Affairs and Chief Medical Officer. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident in each and every patient encounter. You all are the face of CHS, and we thank you for all you do for our patients and residents every day. Each year, millions of older people fall, often with devastating consequences. According to the U.S. Centers for Disease Control and Prevention, 1/3 of Americans age 65 and older fall each year, and falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions among older adults. This topic is near and dear to me as an emergency physician and even personally with my own father. Falls are frequent, they are traumatic, and they can have devastating consequences on you or a loved one. Today's show is going to focus on sharing what CHS is doing in partnering with the Department of Health and also what we've built into our intrinsic care programs to help us move forward to prevent these devastating injuries. On today's show, we'll focus on what you can do to reduce your risk of falling, both in your own home and the falls prevention programs and strategies offered throughout Catholic Health Services and in your community. I'll be joined by Eileen Esposito, the Vice President of Ambulatory Clinical Practice for Catholic Health Services of Long Island, and Cris, Cardinal, the Director of Performance Improvement at Our Lady of Consolation Nursing and Rehabilitative Care Center, Good Samaritan Nursing Home, and St. Catherine of Siena Nursing and Rehabilitation. Also joining me will be Jill Boccieri, the Director of Rehabilitation Services at Good Samaritan Hospital Medical Center, and Owen Durney, the Management Coordinator for the Division of Preventive Medicine, Suffolk County Department of Health Services. We have lots of important information coming your way, so please stay tuned. We'll be right back with today's episode of CHS Presents Health Connect. Welcome back to CHS Presents Health Connect. For patients that may be at risk for falling in the home, the Falls Prevention Program aims to assess, educate, and treat at-risk patients as part of a collaborative effort involving all Catholic Health Services of Long Island's entities and a number of physician practices and ambulatory sites. Joining me now to discuss this is Eileen Esposito, the Vice President of Ambulatory Clinical Practice for Catholic Health Services of Long Island. Welcome, Eileen, and thanks for being here.
Thank you, Dr. O'Shaughnessy. It's an honor.
So it's a really important topic. So many of our viewers don't really appreciate what a significant impact falls can have on the lives of their loved ones. And we want this to extend out into the ambulatory network. So maybe we start with talking a little bit about our ambulatory physician network. Can you share a little bit with our viewers about the number of practices that CHS owns and operates, as well as where they span?
Oh, sure. It would be a pleasure. We have a very extensive network of physicians. We have over 200 physicians that are located right in the community. They stretch from all the way out on the East End to Western Queens. We have over 60 locations of care. So if you need care, we're right there in your neighborhood.
So that's wonderful, really spanning from the Far East into Queens. And Does that span all specialties? And how about primary care?
Primary care is a focus of ours. And we also have a strong cardiology, orthopedics, oncology network, and many other specialties.
Wonderful. So really comprehensive care located
Yes.
right in the communities in which we serve. Relating to falls, tell us a little bit about the great work that you've led on in the quality program. Again, I always go back to quality and safety first, but what we've realized is there's such great opportunity to extend many of the screening tools and other ways in which we can assess patients who are at risk for falls. And not just focus on the hospital. I mean, I'm an ED doc, right? So I would see patients many times, unfortunately, when they already had that event. So tell us a little bit about what you've built and what we're doing in the ambulatory practices to screen patients effectively for falls.
In ambulatory, we're really focused on prevention. As you said, we don't want the patients visiting you in the emergency room. We want them to stay healthy in their home. So focusing on prevention, what we do is we screen every patient 65 and older for their potential risk for falls. We ask questions about, have you fallen before? Do you use assistive devices like a cane or a walker? Do you have any visual issues that's not corrected with glasses? And we know that the majority of internal medicine patients are often on 14 or more prescription medications, and that those medications can interact with each other and make it difficult sometimes for patients. So when we screen our patients, it's a very simple questionnaire, and if they screen positive, we then connect them to Catholic Health Home Care. The beauty of connecting them to Catholic Health Home Care is that a registered nurse will go into the patient's home environment and really work with the patient, look for trip hazards such as scatter rugs or electrical cords, but it's also a teachable moment. The patient's in their home, they're comfortable, and they can begin to talk to the patient about balance training, about hazards related to falling, because when patients fall, their quality of life is so impacted.
There's no question. Or as an example, as you're going through the medication reconciliation process, looking at polypharmacy, all the different drugs as they interact. This was an issue near and dear even with my own father, who was having recurrent falls. And who lives in Florida, unfortunately, I don't have him up here with me to be part of these programs and services here. And when you chased it through all of the issues, it was relating to a different drug that was added on, and no one took the time to explain to him that this may make you a little dehydrated, it may make you dizzy, and we were wound up actually being able to alter his medications, get him off of that med, and guess what? His symptoms went away. And he wasn't falling anymore. So I think it's really important to have those kind of conversations with patients. Share a little bit about in the office how our providers do that through the tool and screening mechanism.
We introduce the tool in the waiting room, so the patient has time to review the questions and really think. Sometimes when patients are in the exam room, they get nervous and they don't, they just want to get that part over with. So we give it to them in the waiting room, and it gives them a chance to answer. And then when they come into the exam room, we go over the questions with them. And we prompt them to remember, because sometimes patients, they don't want to tell you about their falls, or it's not that important. But when you begin to talk to them and they tell you, oh, yeah, I did fall, I fell a couple times. You begin to have that teachable moment. You begin to use the tools that we have. And we also have a wonderful program in our local community called Stepping On. And Stepping On is for perhaps our more highly engaged patients, patients who are at risk for falls but are still very well. And they can go to their local library and they can work on balance training, because balance training, especially in the elderly, is so important to avoid the falls with the fractured hips and
no question.
Other
it's
negative.
really about getting upstream of disease and preventing harm where possible. So I want to thank you, Eileen, for joining us and sharing the wonderful programs that we have in place at Catholic Health Services. I know, and our patients know, you and the team are making a great impact. Thank you. We'll be right back. Hello, and welcome back to CHS Presents Health Connect. Keeping our patients safe in their own homes and also when they choose one of our locations to be their home are both extremely important to us at Catholic Health Services. Joining me now is Cris Cardinal, the Director of Performance Improvement at Our Lady of Consolation Nursing and Rehabilitative Care Center, Good Samaritan Nursing Home, and St. Catherine of Siena Nursing and Rehabilitation Center. Welcome, Cris. Thank you for joining us.
Thank you for inviting me.
Well, we're thrilled to have you here on a very, very important topic, falls reduction. And, you know, we talked a little bit last segment about the ambulatory side. We've discussed also, and we will discuss further, the hospital side. But I want to talk importantly about continuing care and about in our subacute facilities. I'd like you to share with the viewers the program that is in place to help mitigate falls. Can you share some of what you've done?
All three facilities, we work collaboratively. We have a falls committee for the three nursing facilities, but also work collaboratively with the hospitals through the CHS committee. So we're able to share best practices. We've learned a lot from each other over the course of, you know, the last year or so. We assess residents from the point of entry into the facility. We use a Morse fall scale.
So what is that? What is that? Is that a risk assessment? Or?
It's a risk assessment.
So again, asking questions about key areas that could lead to a fall?
Correct. Whether they've had a history of falls, whether they have gait issues, do they use devices, certain medications. But we found that wasn't sufficient over time. So we've created two other pieces of an assessment. One is where we actually interview the resident and what their concerns are, whether they have a fear of falling, you know, what were some of the issues in their past that may have put them at higher risk. And then there's a nursing assessment, which looks at everything from footwear to habits, some of the desires and preferences they may have. And then we try to individualize the plan of care for that person to try and reduce falls for them.
So multifaceted, multi-collaborative effort, bringing together the patient's assessment, the nursing assessment, standardized tool to reduce the incidence of injury from falls and from falling. I see you have a beautiful yellow button on Call Don't Fall. Let's talk a moment about that for our viewers.
It was one of the initiatives we put through the committee to try and, I guess, make it more obvious to not only the residents but to the staff. And actually one of our facilities also took this same thing and made something for the ceiling tiles in the rooms for those that have a tendency to fall or get out of bed without calling.
So actually as they would look up, there would be the sign to just place the call so someone would come and help.
Correct.
Wonderful idea, wonderful idea. Now you guys have also incorporated into this, again, we spoke a lot about polypharmacy and some of the drugs that can be causal factors for falls for our residents. And talk a little bit about the wonderful program that you guys have to reduce some of these medications and what you've seen as a corollary in terms of reducing fall rate. Because I know that the facilities are performing very well below state average in terms of this. And I happen to think that because of what you've described just now, as well as some of the efforts to reduce utilization of some of these medications, that's what's impacting the residents positively.
We had worked collaboratively on a Six Sigma project initially. Out of that, we found that there were certain common factors, created a database that helped us collect all that information, and there were certain medications that were always flagging on residents that fell. One of them primarily were the psychoactive medications. So through our efforts, we've mostly, I guess, we started out with the antipsychotic medications, the highest risk medications. All three of the facilities have reduced them dramatically below the benchmark.
Correct.
Most of us are below 10%. The actual average is 19.5%.
And you've done great work with the sedative hypnotics, things like benzodiazepines for our viewers, and Valium, other medications that may be given. But aside from changing the practice patterns, you've also instituted some really interesting new ways to calm patients. Talk a little bit about Project Lavender and also some of the other areas that things that you've initiated to calm patients naturally and also reduce the incidence of falls.
There was an article relative to lavender therapy, and that it has a calming effect. We used it as a pilot project on one particular community that had a high incidence of behavioral issues. We used lavender spray, we used lavender lotion. I think the lavender is part of it, but I also think it was having someone sit and put some lavender lotion and
that personal
give them that personal contact. dramatically decreased the behavioral incidents on that particular community. We also started a music and memory program.
Talk about that. So tell us about that. Was actually recently published in the New York
Yes.
Times, but you guys were already doing this.
Yes. Music and memory is where you individualize the music for each individual person as to what their likes and preferences are as far as music. It's an MP3 player with headphones. And it's worked behaviorally as well as kind of diversional activity. You know, one of the, I guess, the most important things is keeping people engaged and active and involved in their communities to help them decrease the incidence of falls as well as behaviors.
That's wonderful. I mean, some great work being done at all of our facilities. I really want to thank you for those efforts because it really is a multi-collaborative approach, engaging the physicians, the nurses, and most importantly, the resident as well, and their family and the care plan. Thank you, Cris, for joining us today. We very much appreciate everything you shared, and we look forward to hearing about next steps with the program.
Thank you.
We'll be right back. Welcome back to CHS Presents Health Connect. Recognizing the public health need to address falls and falls prevention, the Suffolk County Department of Health Services began working with community partners, such as Catholic Health Services, to help senior citizens live healthy and independent lives. With us today to discuss the free workshops and programs available in your community is Owen Durney, the Management Coordinator for the Division of Preventive Medicine for the Suffolk County Department of Health Services, and Jill Boccieri, the Director of Rehabilitation Services from Good Samaritan Hospital Medical Center. Welcome, Jill. Owen, thank you for joining us today.
Thank you.
Thank you.
So, Owen, let's start a little out with you. Tell us a little bit about the Stepping On program. How did it start? How long has it been in existence?
The Stepping On program is actually an evidence-based falls prevention program. It was developed in New Zealand, and the CDC, recognizing the problem associated with falls, wanted to bring that program into the United States and offered it, actually selected 3 states to pilot the program, and New York was one of them. Suffolk County was one of 3 counties selected in New York to be part of that project and to implement those programs with CDC funding from New York, that came from New York State. So that started in 2010 is when we got that grant. It was a grant project.
Right.
And the reason why we were selected is because Suffolk County, seeing that this was a problem, understanding also the fact that we have an aging population,
Correct.
Decided that this was going to be a priority in our community health assessment and our community health improvement plan. So we worked with different organizations, different hospital systems, and community-based organizations, and Catholic Health Services has actually been a long-term partner of ours and one of the pioneering partners to help us get this program off the ground.
So, Owen, let me ask just a few more questions then. Tell me who could attend the Stepping On program, and why is it so important? Is this a significant issue in not just Suffolk County, but all of New York and perhaps the country in general?
Well, it's certainly a significant issue throughout the country. This is one of the reasons why the CDC recognized this as an issue and a problem. Right. And again, talking about the aging population of both Nassau and Suffolk, our county, Suffolk County Department of Health, recognized it to make these programs, or to educate our public about the significance and the importance of avoiding falls. And you bring up a great point. Most people don't really understand what the significance of a fall is until they've experienced it at a minimum one time, and many times more than once.
Yes.
And by that time, the level of recovery, or the recovery to a previous level of functioning, gets diminished with each fall that an individual takes. So our department wants to reach as many people within the community as possible, not to avoid that event.
Perfect. Getting upstream from harm. Share a little bit then within the Stepping On program. What are some of the elements that you offer to people to participate? What's the benefit for them?
Well, the benefit is the Stepping On program is a 7-week program. And that may sound intimidating to some people.
Right.
It may be not just intimidating to participants, but also to the venues where we hold our classes, because you have to devote time and space and staff. So the county developed its own sort of condensed program. It's a 2-hour program that covers all the major points of falls prevention, things like medication review,
Sure.
Vision screening, making sure, because these are factors that people don't associate with a fall.
Correct.
Most people associate with falls things like tripping over rugs, scatter rugs, and cords and extension cords and things. That's certainly a factor, but there's other more important factors like medications,
No
and
question.
vision, and core strength, body strength and balance. So these are covered in a very brief way in the Staying Independent for Life program that our 2-hour program, which is used to introduce the concept to the participant, so that by the time they leave that program, they're thinking, oh, geez, I need to make
That's
a
right.
commitment to the 7-week program. So it's open to anybody. Our target population is age 55 and up. Most people that come to our programs right now are in the they're 65 and up. So,
Perfect.
But younger seniors need to understand that it's just as much of an issue for them.
So that's
too.
kind of a perfect transition then, Jill, into some of the work that you do. Maybe you could share a little bit about Good Samaritan Hospital's rehabilitation program, how it got involved in the Stepping On program, and the services that you offer at Good Sam.
Okay, so we initially got involved with the Department of Health through their an injury prevention program committee that they formed in 2008. So we have a long-standing history together of partnering with them, and it was really good. Sam, we had a therapist that had done her dissertation in the aging population and falls, very interested in it. In 2010, when the Suffolk County Department of Health was going to send people to be trained in Stepping On in Wisconsin, they asked if this therapist would like to join them, and she has been the main person for the past 5 years, along with a person in the Suffolk County Department of Health who has gone around in Suffolk County.
So you had someone who's been now a trained expert
been doing
there.
it for 5 years. They're leaders. There's only 2 leaders in Suffolk County right now. So what that went on to be in the past year, how we got this into CHS was they wanted Sue Cullen and Nellie. They're the famous people doing this program. Everybody in Suffolk County who's done it knows them. They were going to be master trainers. So they went and got trained to be master trainers, which means you can train other leaders. So when we heard this, Owen opened it up to us to say, if they're going to train, would you like people in CHS? So this was our opportunity, really, to make this a CHS initiative.
It's wonderful.
And reach out to all the hospitals. So we actually started with 1 training, and I got so much feedback when I reached out to all the hospitals, the people that wanted to be trained. We had to limit it to almost 2 people at each of our facilities.
So an overwhelming...
And had a waiting list.
Yeah, a waiting list.
So we did 1 training, and now we are starting to spread it. We're all doing Stepping On classes throughout the system. I also trained a bilingual therapist, so we can reach out into our community, into that population of we find a big Spanish population out there, Spanish-speaking population.
So this is excellent. So we have well-trained experts that could really assist our patients in assessing for their risk of falls, and also helping them improve in some of the key areas that Owen talked about, whether it be medication management, strengthening core body strength, doing the things that we know will impact our patients positively.
And just on the side, to the part of the 7-week program, you have to bring in experts, and Good Sam and the system has always provided the physical therapist, the occupational therapist. We have 2 pharmacists that actually go out to all the Suffolk County Stepping On programs and participate. And we have an eye doctor who also is affiliated.
Well, I know the benefits of what this collaboration has been for our facilities and our patients and residents, and I thank you both so very much. I wish we had this program down in Florida for my family members, but when they're up here, they partake in these services as well. Special thanks to Owen Durney and Jill Balcieri for joining us. We have to take a quick break, but we'll be right back with more information on falls prevention programs available in your neighborhood on CHS Presents Health Connect. Welcome back, everyone. So some final thoughts on today's topic of falls. Falls are a mechanism for significant injury, especially in our loved ones 65 years of age and older. Please recognize the signs and symptoms for potential falls. Share that with your primary caregiver and know what resources are available out there in the community, as we heard today, as well as the resources that are available either at a CHS practice or a CHS facility to help you reduce the possibility of these events happening in your family. If you'd like to know more about CHS's fall prevention programs, or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you would like for me to answer on a future show, or a topic you'd like to see showcased, please give us a call at 1-855-CHS-4500, or you can email us at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.